One of the more common procedures that we perform is an anterior cervical discectomy, fusion, and plate. When we do an anterior cervical discectomy, fusion, and plate, that means we're going through the front of the spine, or the anterior part of the neck. What happens inside your body to result in needing this operation is that when we look at the cervical spine, there are 7 bones in the neck. Each of those is separated by the disc. The disc is cartilage, like your nose or your ear. It's firm, rubbery stuff. It doesn't have a blood supply. And when we're young, it's well hydrated, it's full of water, it's juicy. But as we age, because of wear and tear and gravity, the disc can wear out. It loses some of its water content. It can become friable. Occasionally, as the disc wears out, the disc will collapse, and then you'll get bone almost grinding on bone. And when that happens, you get little microscopic cracks in the bone. Your body tries to heal that by laying down calcium, just as if you were to break your wrist, you'd have a lump of calcium there. When that calcium spur forms, it can grow back and it can pinch the nerve as it exits, which is what I'm demonstrating here. This yellow thing represents a nerve root, and this more dark space is the disc. So when we do the anterior cervical discectomy and fusion with plate, again, we go through the front of the neck, we go through this muscle, which is called the platysma, and all the structures in the neck basically go north and south. You can almost stick your finger in there and separate those tissues so that the trachea and the esophagus go to the left, carotid artery and jugular vein go to the right, and your spine's really only 2 inches deep. So we put a retractor in, keep that open. We do our work under the microscope where we remove the disc, and we go all the way back to the posterior part of the disc space and remove the bone spurs that might be compressing a nerve root. When you take out the disc, you have to replace that with something, because if you just leave bone on bone, then you're going to develop more and significant bone spurs and more neck pain. So the portion of the fusion is putting in a spacer packed with bone graft. And so we want these 2 bones to grow together as one. And then we put a little plate on with 2 screws that go in each bone above and below to hold those together, sort of like rebar. The bone graft is the concrete and the plate is the rebar. It's only useful during the time that your bone is fusing, but there's no reason to take it out once you've healed from your procedure. So when we do the exposure for the anterior cervical discectomy and fusion with plate, again, we go through the front of the neck and we're separating the trachea and esophagus from the carotid artery and jugular vein. We put that retractor in there, and remember, you've got a breathing tube in your trachea, which is absolutely imperative because you're under general anesthesia. So the retraction on your neck and on your breathing tube can sometimes cause some difficulty swallowing. It's not infrequent that patients wake up with a sore throat, a little difficulty swallowing, and sometimes some crankiness and some tightness in the back of the neck. Again, those are all expected issues that occur after an anterior cervical discectomy and fusion with plate. The job of the procedure is to relieve either your spinal cord or your nerve root that is being impinged upon. And the nervous system does at some point take a certain amount of time to recover. So once we do the operation, please expect that it's not like a light switch. It does take those nerves some time to recover, but within 2 to 4 weeks, you'll probably notice some improvement in your symptoms.